vision, dry eyes, eye strain, night blindness, or age-related vision decline, the solution may not be expensive eye drops or supplements. It may be sitting right in your kitchen. Today, we're going to talk about exactly what to eat for better vision, how these foods repair and protect your eyes, and how to easily add them into your daily meals. Every single second, your eyes process more than 10 million pieces of information, translating light into vision, color into meaning, and motion into survival. Yet most people never realize that the future of their eyesight is being decided quietly, invisibly, on their plate 3 times a day, long before blurry vision appears, long before glasses become stronger, and long before degenerative eye diseases take hold. The cells inside your eyes are already reacting to what you eat. Science now confirms that nutrition does not just influence eyesight, it controls it. And what's shocking is that up to 80% of vision loss worldwide is either preventable or reversible simply through proper nutrition. That means millions of people are losing their eyesight not because of age, not because of genetics, but because of daily food choices. Your eyes are among the most metabolically active organs in your body, requiring a constant stream of oxygen, antioxidants, vitamins, minerals, and healthy fats just to function normally. The retina alone consumes more energy than nearly any other tissue in your body. Every blink, every focus shift, every adjustment to light depends on microscopic chemical reactions that cannot happen without proper nutrients. When those nutrients run low, damage begins silently. Studies show that vitamin A deficiency remains one of the leading causes of preventable blindness worldwide, affecting millions, especially in developing regions. But even in developed countries, subclinical deficiencies slowly degrade vision for decades before symptoms appear. By the time blurred vision, dryness, night blindness, or eye strain show up, cellular damage has often been accumulating for years. Vitamin A is essential for the production of rhodopsin, the light-sensitive pigment in your retina that allows you to see in dim light. Without it, night vision collapses and the retina becomes vulnerable to degeneration. But vitamin A does far more than that. It maintains the integrity of the cornea, the transparent window at the front of your eye, and supports immune defenses that protect against infections that can permanently scar vision. Research published in the journal Nutrients shows that even mild vitamin A deficiency increases the risk of dry eye syndrome, corneal ulcers, and retinal damage. Yet modern diets, overloaded with refined carbohydrates and processed foods, often contain dangerously low levels of this vital nutrient. Egg yolks, once demonized for cholesterol, have now been proven to be one of the most powerful eye-protecting foods on Earth. They contain lutein and zeaxanthin, 2 carotenoids that accumulate directly in the retina, forming a natural protective shield against blue light and oxidative damage. A landmark study published in Clinical Nutrition found that daily consumption of whole eggs significantly increased blood levels of these compounds and improved visual processing speed, contrast sensitivity, and glare recovery. In simple terms, eggs help your eyes see sharper, faster, and clearer, especially in bright light and digital environments. Removing the yolk removes the very nutrients your eyes need most. Dark leafy greens like spinach, kale, and Swiss chard provide a dense concentration of lutein, zeaxanthin, vitamin C, and beta-carotene, all of which work together to defend your retina against oxidative stress. Oxidative stress is one of the main drivers of age-related macular degeneration, the leading cause of irreversible blindness in older adults. Studies show that people who consume the highest amounts of leafy greens reduce their risk of macular degeneration by up to 43%. That means nearly half of age-related vision loss could be prevented simply by adding greens to your daily meals. Fatty fish such as salmon, sardines, and mackerel supply omega-3 fatty acids, especially DHA, a structural fat that makes up nearly 60% of the retina's fatty acid content. Without adequate DHA, the retina becomes fragile, dry eye symptoms intensify, and neural signaling between the eyes and brain weakens. Research published in the American Journal of Clinical Nutrition shows that omega-3 intake dramatically reduces the risk of dry eye disease, improves tear production, and supports retinal integrity. In one study, participants consuming omega-3 rich diets reported significant improvement in eye comfort, visual clarity, and reduced fatigue after only 6 weeks. But perhaps the most shocking truth is how sugar and refined carbohydrates quietly destroy vision. High blood sugar damages the tiny blood vessels that nourish the retina, leading to diabetic retinopathy, a condition now responsible for blindness in millions. Every spike in blood glucose causes oxidative stress, inflammation, and microvascular injury inside the eye. Over time, this damage accumulates, thickening retinal capillaries, reducing oxygen delivery, and triggering abnormal blood vessel growth that can bleed and scar retinal tissue. Research shows that chronically elevated blood sugar accelerates eye aging by decades, making a 40-year-old's eyes function like those of a 70-year-old. Zinc, often overlooked, plays a critical role in transporting vitamin A from the liver to the retina. Without zinc, vitamin A remains trapped in storage, unable to reach the eye where it is needed most. This leads to impaired night vision, slower visual adaptation, and increased vulnerability to infection. Oysters, red meat, pumpkin seeds, and eggs supply highly bioavailable zinc, yet deficiency is widespread, especially among older adults. Studies reveal that low zinc levels correlate strongly with age-related macular degeneration progression, meaning zinc intake may directly determine how quickly eyesight declines with age. Liver stands as one of the most nutrient-dense foods on the planet, delivering massive doses of vitamin A, B vitamins, iron, copper, and zinc in highly absorbable forms. Just one small serving provides several days' worth of eye-protective nutrients. In traditional cultures, liver was reserved for pregnant women, children, and the elderly precisely because of its powerful role in tissue repair, immune defense, and vision preservation. Modern diets, however, have largely eliminated organ meats, replacing them with empty calories that accelerate nutrient depletion and eye degeneration. Even hydration plays a crucial role. The tear film that coats the surface of your eye is composed of water, oils, and mucus layers that protect vision and prevent dryness. Dehydration thickens tears, destabilizes this protective layer, and increases inflammation. Studies show that even mild dehydration can reduce tear production and worsen symptoms of dry eye, leading to irritation, blurred vision, and sensitivity to light. Proper hydration combined with omega-3 fats restores tear stability and visual comfort. Sunlight, often feared, is essential for regulating circadian rhythms that govern eye repair. Morning sunlight exposure synchronizes retinal metabolism, enhances dopamine production, and supports long-term eye health. Excessive artificial blue light at night disrupts this cycle, increasing oxidative stress in retinal cells. Nutrition rich in antioxidants becomes even more critical in counteracting this damage. What makes all of this so powerful is the body's remarkable capacity for healing. Clinical studies show that dietary changes can improve retinal function, visual acuity, contrast sensitivity, and dry eye symptoms in as little as 4 to 12 weeks. That means your eyesight is not fixed. It is dynamic, responsive, and deeply influenced by what you choose to eat every single day. Your eyes are not aging because of time. They are aging because of nutritional neglect. Every meal is either feeding degeneration or fueling regeneration. Each bite of nutrient-dense food delivers molecular building blocks that rebuild retinal tissue, strengthen neural connections, and restore visual clarity. And each bite of sugar, processed grains, and industrial oils accelerates cellular breakdown that leads to vision loss. The greatest tragedy is not blindness itself, but blindness that could have been prevented. The science is clear. The solution is simple. The power is already in your hands. What you choose to eat today will determine what you see tomorrow. And once you truly understand that food is not just fuel, but visual medicine, you realize that protecting your eyesight is not complicated, expensive, or out of reach. It begins with awareness. It continues with daily choices, and it ends with a future where your eyes remain sharp, clear, and alive for decades to come. Your ability to see clearly, especially in low light, to focus sharply, to blink without pain, and to read these very words without strain depends on 3 invisible nutritional forces working perfectly inside your body: vitamin A, zinc, and omega-3 fatty acids. These nutrients are not optional. They are structural components of vision itself. Without them, your eyesight does not merely weaken, it collapses. And what makes this terrifying is that deficiencies in these 3 nutrients are now exploding worldwide, silently pushing millions toward irreversible vision damage. Vitamin A is the foundation of human vision. Without it, the retina cannot convert light into electrical signals for the brain. This conversion depends on a molecule called rhodopsin, which exists only because of vitamin A. When vitamin A levels drop, rhodopsin production collapses and night vision disappears first. This is why one of the earliest signs of deficiency is night blindness. People suddenly find themselves unable to drive after sunset, struggling to adjust when entering dark rooms, or feeling disoriented in low light. But what feels like a mild inconvenience is actually a warning sign of retinal starvation. According to the World Health Organization, vitamin A deficiency is one of the leading causes of preventable blindness worldwide, responsible for up to 500,000 new cases of childhood blindness every year. But adults are far from safe. Subclinical vitamin A deficiency is now widespread in developed nations due to processed diets stripped of natural nutrients. Research published in the journal Nutrients shows that even marginal vitamin A deficiency increases the risk of dry eye disease, corneal damage, infections, and accelerated retinal aging. That means millions are losing vision slowly, silently, and unnecessarily. Vitamin A also maintains the health of the cornea, the transparent surface that allows light to enter your eye. Without enough vitamin A, the cornea becomes dry, thickened, and scarred. In extreme cases, this leads to a condition called xerophthalmia, where the eyes become painfully dry, inflamed, and ultimately blind. Once corneal scarring occurs, vision loss becomes permanent. And yet this devastating condition remains one of the most easily preventable health tragedies in modern medicine. Zinc acts as the silent transporter of vision. Without zinc, vitamin A cannot even reach your eyes. It remains locked inside the liver, inaccessible to retinal tissue. Zinc is required for over 300 enzymatic reactions in the body, but one of its most vital roles is escorting vitamin A into the retina, where it can be converted into the light-detecting molecules that allow sight. When zinc is deficient, night blindness intensifies, visual recovery slows, and immune defenses in the eye weaken. Large population studies show that zinc deficiency dramatically increases the risk of age-related macular degeneration, the leading cause of irreversible blindness in people over 50. A landmark clinical trial published in the Archives of Ophthalmology revealed that zinc supplementation slowed the progression of macular degeneration by up to 25%. That means one simple mineral can delay blindness for years, sometimes decades, yet zinc deficiency remains widespread due to soil depletion, modern farming practices, and ultra-processed diets. The retina is one of the most zinc-rich tissues in the human body. When zinc levels fall, retinal cells struggle to repair oxidative damage. Light exposure, especially blue light from screens, generates massive amounts of free radicals inside the retina. Zinc-dependent enzymes neutralize this oxidative assault. Without zinc, retinal cells age rapidly, inflammation rises, and microdamage accumulates until vision begins to fail. Omega-3 fatty acids, particularly DHA, form the structural backbone of your retina. Nearly 60% of the fatty acids in the retina are DHA. This fat maintains membrane fluidity, allowing photoreceptor cells to transmit signals rapidly and efficiently. When DHA levels decline, the retina becomes rigid, fragile, and prone to degeneration. Dry eye symptoms intensify, tear production weakens, and neural communication between the eye and brain slows. Clinical research published in the American Journal of Clinical Nutrition shows that omega-3 deficiency directly contributes to dry eye disease, retinal inflammation, and visual fatigue. In one randomized trial, participants who consumed omega-3 supplements experienced significant improvements in tear stability, eye comfort, visual clarity, and reduced light sensitivity within just 6 weeks. That means eye discomfort many accept as normal aging is actually a nutritional emergency waiting to be corrected. Dry eye disease now affects more than 300 million people worldwide. Burning, itching, redness, blurred vision, and constant irritation plague millions daily. Yet the primary cause is often omega-3 deficiency combined with excessive screen exposure. Modern diets, dominated by omega-6 industrial seed oils, disrupt fatty acid balance, triggering chronic inflammation in the tear glands. Omega-3s restore this balance, calming inflammation and rebuilding tear film stability. But the story becomes even more alarming when blood sugar enters the equation. High glucose levels rapidly deplete zinc and omega-3 stores while increasing oxidative stress that destroys vitamin A. Diabetic retinopathy, a condition caused by chronic blood sugar damage to retinal blood vessels, is now one of the leading causes of blindness globally. Each blood sugar spike tears microscopic holes in the retinal capillaries, leading to leakage, swelling, and eventually irreversible scarring. Studies show that tight blood sugar control combined with high omega-3 intake significantly reduces retinal inflammation and vascular damage. Omega-3s strengthen blood vessel walls, reduce clot formation, and improve microcirculation inside the eye. In populations with high fish consumption, rates of diabetic retinopathy are dramatically lower, despite similar diabetes prevalence. As people age, absorption of vitamin A, zinc, and omega-3s declines. Stomach acid decreases, digestive enzymes weaken, and gut inflammation rises. This creates a dangerous feedback loop where aging accelerates nutritional deficiency and nutritional deficiency accelerates aging. The result is rapid deterioration of eyesight after 50, but this decline is not inevitable. Clinical evidence shows that restoring nutrient levels can dramatically improve visual function even in older adults. One study published in Ophthalmology followed patients with early macular degeneration who adopted nutrient-dense diets rich in vitamin A, zinc, lutein, and omega-3s. After 12 months, participants showed measurable improvements in retinal thickness, visual acuity, and contrast sensitivity. In other words, damaged retinas began to rebuild. Your eyes regenerate constantly. Photoreceptor cells renew their outer segments every 10 days. This process requires massive nutritional input. Without proper fuel, renewal fails and degeneration accelerates. But with optimal nutrition, the retina can repair itself again and again, restoring clarity, brightness, and resilience. What makes this revelation so profound is how quickly improvement can occur. People suffering from years of dry eyes report relief within days of increasing omega-3 intake. Night vision improves within weeks of correcting vitamin A deficiency. Visual sharpness and contrast sensitivity rise as zinc levels normalize. The body responds rapidly when given what it needs. Yet modern diets push the opposite direction. Processed foods strip nutrients while flooding the bloodstream with sugar and inflammatory oils. This toxic combination starves the retina while accelerating cellular destruction. Vision loss becomes not an accident, but a predictable outcome. The tragedy is not blindness itself. It is blindness that never had to happen. It is children losing sight because their diets lacked simple nutrients. It is adults surrendering to glasses, surgeries, and medications without ever addressing the nutritional foundation of vision. It is generations taught to fear natural fats, avoid organ meats, and replace real food with artificial substitutes that slowly steal their sight. Your eyesight is not fragile. It is resilient beyond imagination. But it is also deeply dependent on daily nourishment. Every meal is a message to your eyes. It either says rebuild, repair, and strengthen, or it says decay, inflame, and deteriorate. Vitamin A, zinc, and omega-3s are not supplements. They are biological necessities. They are the building blocks of sight. Without them, vision fades. With them, clarity returns. The choice is simple, but the consequences are enormous. Because what you eat today will shape how clearly you see tomorrow, next year, and decades from now. And once you understand that, you realize that protecting your vision is not about fear. It is about empowerment. It is about reclaiming control over one of your most precious senses. And it begins not in a clinic, not in a pharmacy, but in your kitchen, one powerful choice at a time. Every time you eat sugar, refined carbohydrates, or ultra-processed foods, something invisible but devastating begins inside your eyes. Long before your vision blurs, long before dryness appears, and long before your prescription glasses become stronger, microscopic damage is quietly unfolding deep inside the retina. Science now confirms that sugar and processed foods do not merely affect your waistline or blood pressure. They directly attack your eyesight, weakening the delicate blood vessels, destroying retinal cells, and accelerating eye aging at a shocking speed. What makes this terrifying is that most people consume these foods daily, unknowingly feeding the very process that steals their vision. Your retina contains some of the smallest and most fragile blood vessels in your entire body. These tiny capillaries deliver oxygen and nutrients that keep vision alive. When blood sugar rises, these vessels become inflamed, swollen, and fragile. High glucose levels thicken the blood, slow circulation, and damage vessel walls, causing them to leak fluid into the retina. Over time, this leakage leads to swelling, scarring, and irreversible vision loss. This process, known as diabetic retinopathy, is now one of the leading causes of blindness worldwide, affecting more than 100 million people globally. And what is most disturbing is that this condition is no longer limited to diabetics. Even mildly elevated blood sugar, caused by daily sugar and refined carbohydrate consumption, can trigger early retinal damage. Every spike in blood sugar creates a wave of oxidative stress inside your eyes. Oxidative stress is the uncontrolled production of free radicals that attack cell membranes, DNA, and proteins. The retina, being one of the most metabolically active tissues in the human body, is especially vulnerable. Studies published in the journal Investigative Ophthalmology and Visual Science reveal that chronic oxidative stress directly accelerates retinal aging and degeneration. This means that the foods you eat today may determine whether your eyes function like those of a healthy 30-year-old or a damaged 80-year-old. Refined carbohydrates such as white bread, pasta, pastries, breakfast cereals, and sugary drinks digest rapidly into glucose. This causes sharp blood sugar spikes followed by crashes that strain the insulin system and inflame blood vessels. Over time, repeated glucose surges weaken retinal capillaries, making them prone to rupture. Microbleeding inside the retina slowly destroys visual clarity. Many people lose significant vision before they ever feel symptoms, making this one of the most silent and dangerous forms of organ damage. Research shows that people consuming high glycemic diets have a significantly increased risk of developing age-related macular degeneration, the leading cause of irreversible blindness in older adults. A landmark study published in the American Journal of Clinical Nutrition followed thousands of participants over 15 years and found that those consuming the highest levels of refined carbohydrates had up to 39% higher risk of developing severe vision loss. That means nearly 4 out of 10 cases of blindness could be linked directly to dietary sugar and refined grains. But the destruction does not stop there. Sugar also depletes critical nutrients required for eye health. High glucose rapidly drains vitamin A, zinc, magnesium, and B vitamins, all essential for retinal repair and visual processing. As these nutrients disappear, the eye's ability to heal itself collapses. This creates a vicious cycle where sugar both damages retinal tissue and removes the very nutrients needed for repair. Perhaps the most shocking effect of sugar is its ability to trigger abnormal blood vessel growth inside the retina. When blood vessels become damaged, the body attempts to compensate by growing new ones. But these new vessels are weak, fragile, and poorly formed. They leak, bleed, and scar the retina, leading to permanent visual distortion and blindness. This process, known as neovascularization, is responsible for the most severe forms of diabetic retinopathy and macular degeneration. Once scarring occurs, vision cannot be restored. Processed foods worsen this damage even further. Industrial seed oils, artificial additives, preservatives, and chemical flavor enhancers flood the body with inflammatory compounds that attack retinal tissue. These foods disrupt mitochondrial function inside eye cells, reducing energy production and accelerating degeneration. Studies now show that chronic inflammation is one of the primary drivers of retinal aging, and processed diets are the single greatest contributor to systemic inflammation. Modern diets contain up to 10 times more omega-6 fatty acids than omega-3s. This imbalance fuels chronic inflammation in blood vessels, including those supplying the eyes. Omega-6 rich oils such as soybean, corn, canola, and sunflower oil oxidize easily, generating toxic compounds that directly injure retinal cells. Research published in Free Radical Biology and Medicine demonstrates that oxidized seed oils increase retinal oxidative stress and accelerate photoreceptor cell death. Children are now developing signs of retinal stress once seen only in the elderly. Excessive sugar intake combined with constant screen exposure creates a perfect storm for early vision decline. Pediatric studies reveal rising rates of dry eye disease, digital eye strain, and early macular changes in adolescence. The human eye was never designed to process refined sugar and artificial chemicals daily, nor to stare at glowing screens for 10 hours straight. But the danger extends beyond sugar itself. Artificial sweeteners, often marketed as healthy alternatives, may be even more destructive. Research indicates that compounds like aspartame and sucralose disrupt gut bacteria, increase insulin resistance, and trigger inflammatory responses that indirectly harm retinal tissue. Animal studies show that chronic artificial sweetener exposure increases oxidative damage in the retina, leading to early degeneration. The most terrifying reality is how quietly this damage occurs. Vision loss does not happen overnight. It builds silently for years. By the time symptoms appear, much of the damage is already irreversible. People often mistake early signs for fatigue, aging, or stress, unaware that their daily diet is dismantling their eyesight at the cellular level. Yet this devastation is largely preventable. Studies consistently show that reducing sugar and processed food intake dramatically improves retinal blood flow, lowers inflammation, and enhances visual function. In clinical trials, participants who adopted low glycemic diets experienced measurable improvements in contrast sensitivity, visual clarity, and retinal thickness within just 3 months. That means the retina, once thought incapable of regeneration, begins repairing itself when inflammatory damage is removed. When sugar is eliminated, blood vessels regain flexibility, oxidative stress declines, and nutrient absorption improves. Zinc and vitamin A levels recover, restoring night vision and tear production. Omega-3 utilization increases, rebuilding retinal cell membranes and stabilizing vision. The body possesses a remarkable capacity to heal, but only when the toxic assault of processed foods is removed. The tragedy is that most people are never told this. They are taught to fear fat, avoid cholesterol, and embrace sugar-laden low-fat products that quietly destroy their eyes. Entire generations have been raised on processed convenience foods that sabotage visual health while creating lifelong dependence on glasses, medications, and surgeries. The true cost of sugar is not measured in calories. It is measured in lost vision. It is measured in elderly individuals who can no longer read, drive, or recognize the faces of loved ones. It is measured in children struggling to see classroom boards and screens. It is measured in the silent suffering of millions who never realized that their blindness was preventable. But within this crisis lies extraordinary hope. Vision loss caused by dietary damage is not fate. It is reversible in its early stages. Blood vessels can heal, retinal cells can regenerate, neural pathways can strengthen, but the healing begins only when the assault stops. Every time you choose whole, unprocessed foods, your eyes receive a message of repair. Every time you reject sugar and refined grains, inflammation falls and circulation improves. Every time you replace industrial oils with natural fats, retinal cells regain strength and resilience. The future of your eyesight is being written at every meal. The difference between clarity and blindness, between independence and dependence, between vibrant vision and fading sight, often comes down to daily food choices. Sugar and processed foods are not harmless indulgences. They are powerful biological disruptors capable of stealing your vision cell by cell. But once you understand this, you reclaim control. You realize that the power to protect your eyesight does not lie in expensive treatments or complicated therapies. It lies in simple, conscious choices repeated each day. And in that realization, something extraordinary happens. Fear transforms into empowerment. Helplessness becomes responsibility. And the act of eating becomes an act of vision preservation. Because the moment you remove sugar and processed foods from your life, you give your eyes the greatest gift of all, the chance to see clearly.